Hey everyone, and welcome to the Chapter 5 lecture for medical terminology. It is all about the cardiovascular system, which consists of the cardio, the heart, and the vasculature, your blood vessels. So this system's purpose is to pump blood throughout the body and circulate oxygen and nutrients and waste to the different tissues. So it's also known as the circulatory system. My word of the day is dextrocardia situ inversus, which is a rare condition and not really, I don't think, harmful, but just kind of odd, which is a condition where the heart is found on the right side of the chest instead of the left side of the chest. So normally the heart and mediastinum is on the right, but in some people, basically, when they're undergoing in utero development as a fetus, a switch gets flipped and things develop backwards. And so the heart is on the right. Again, I don't think it leads to any increased risk of disease of any kind, but it can throw a doctor for a loop if they're looking for a heartbeat, or if they were trying to do heart surgery, something they need to know about, or might come as a surprise when they give somebody an x-ray. So dextro is the Latin term for right, and cardio, of course, heart, condition, and situ inversus means it's inside and it's inverted, it's backwards. So the heart is normally located, of course, in the mediastinum on the left side of the chest. So remember, the right side is the patient's right, and this is the patient's left side. It's with the mediastinum is found within the thoracic cavity. So the thoracic cavity, holds the lungs, and this inner cavity, the mediastinum, which is outlined in yellow here, holds the heart. But then also here's the thymus, this little frozen yogurt turd on top there, and then some of the major vessels and parts of the trachea as well. So the heart, let's start there. The heart is the main organ of the cardiovascular system, and it is divided into 4 chambers. This is just a cartoon heart, but there's 2 top chambers and 2 bottom chambers. The top chambers are called atria. Single one would be an atrium, so atria is plural. So there's the right and left atria, and the right and left ventricles on the bottom. The way I remember ventricles are on the bottom is because the bottom of the heart is where the tip is, and it's kind of shaped like a V. So the ventricles are the part of the heart that's shaped like a V. You also might just remember it sort of alphabetical order. A comes before V in the alphabet, so A is on top, the atrium are on top, and the ventricles are on the bottom. The heart is also divided into right and left halves. There's a wall dividing those 2 halves, and that wall is called the septum. Septum is just a medical term for a tissue, a dividing wall that's made of tissue. So you also have a septum in your nose. We didn't really talk about that in the respiratory system, but you'll see that word in some other body systems. And the tip of the heart, which happens to be on the bottom, not the top, is known as the apex. So apex means tip. With the lungs, the apex was at the top, but with the heart, the apex is at the bottom. So here's a more anatomically correct pictures of a heart. So here's the heart from the outside. You can see the atria here. This is the right atrium and the left atrium. And then these are the ventricles, which are really surrounded by muscle. I mean, this is muscle too. If we cut the heart open in half, we can see the inside of these chambers. So they are hollow, then filled with blood. So here's the right atrium, and here's the left atrium, which is sort of behind this pulmonary artery. And then down here are the right ventricle and left ventricle. The color coding that you see is commonly used in books, with blue representing deoxygenated blood and red representing oxygenated blood. So deoxygenated blood lives on the right side of the heart. It gets pumped to the lungs, as we'll see in a minute, and then that fresh oxygenated blood comes back from the lungs and enters into the left side of the heart, which is responsible for pumping that rich oxygen blood out to the body. You can also see the valves on this slide, but I'll talk about those later. So here I just really wanted to focus on the right atrium, right ventricle, left ventricle. Another thing to point out here is looking at the muscle tissue. We're going to talk about the roles and the blood flow through the heart, but look how thin the muscle is around the side of the right ventricle, whereas around the left ventricle it's very thick. This has to do with the fact that the left ventricle is pumping blood to the body, which is a lot, further. You got to get blood all the way down to your toes, whereas the right ventricle is pumping it out to the lungs. So this is my slide on blood flow, and this is really important to know the blood flow, even though this is a terminology class and this is more anatomy, physiology. It's something I like to stress because students really need a lot of practice with it. So some mnemonics that I have that have to do with medical terminology is that blood arrives to the atria. So an atrium, like in a house or a mall or something, a building, is kind of like a foyer or like an open space, like a welcoming entrance. So I think of atrium as an entrance, but also you can use the mnemonic that it arrives in the atria. They both start with A, and it leaves via the ventricles, and leaves has a V in it for ventricles. So deoxygenated blood from the body will enter into the right atrium and then go to the right ventricle, where it will get pumped to the lungs, get oxygenated in the lungs, come back into the left atrium, where it then goes into the left ventricle and will get pumped out and go to the body, where it can deliver all that fresh oxygen. And it just keeps doing this over and over and over again. So I pointed these out briefly before, but there are valves in the heart that control blood flow. So valves are also found, we'll talk about them in the veins. Valves are basically things that help fluids to flow in one direction and not in the reverse direction. So it's like a little door, a little trap door between the atrium and the ventricle, so that when blood gets pumped from the atrium to the ventricle, it doesn't get sucked backwards. So the valve opens when it pumps, and then it promptly closes to keep blood from flowing backwards. So there's the tricuspid valve here on the right side of the heart, and on the left side of the heart here is the mitral valve, also known as the bicuspid. All right, the tricuspid has 3 cusps, or 3 little leaflets. Makes me think kind of like a, where you insert a straw on like a drink, like a cup lid, has a little straw insert. All right, that's a type of valve. It looks very much like your heart valve. The bicuspid valve has 2 cusps. So it also reminds me of a drinking apparatus. If you ever had like a Camelback straw where you kind of have to like bite it or squeeze it, and then it opens up. So when it's closed, they look like this. When they're open and blood can flow through. The other 2 valves are found in these big vessels here. So in the pulmonary artery, the blood is going to the lungs. So this is called the pulmonary valve. And in the aorta, which is this big red vessel here, that's the aortic valve. So if we want to look at the different layers of the heart, there's a sort of an inner layer and an outer layer, and a middle layer. So the inner layer is the inner lining of the heart, really, is called the endocardium. So imagine you're inside, you like shrunk yourself down, like you're in Miss Frizzle's class and you take the magic school bus into the heart. And you get out and you're walking around and you're touching the walls inside the heart. That's the endocardium. So it's the inner lining of the heart. And then there's also a lining on the outside that's called the pericardium, or sometimes it's called the epicardium. They're synonymous terms. One means around the heart, the other means upon or above the heart. It's kind of similar. And there's actually 2 layers, kind of like we see with the pleura around the lungs. So we had the visceral and parietal pleura of the lungs, and in between there was the pleural fluid. So with the heart, the with the theme that we see with all of our vital organs is they're kind of surrounded by membranes that are fluid-filled, which help to just kind of cushion them and keep them chafing up against other things. So the parietal pericardium is the outer membrane, and the visceral pericardium is the inner membrane, and then there's pericardial fluid here in the middle that helps to kind of cushion the heart. Too much pericardial fluid, though, can compress the heart and be bad, and we'll talk about that condition later. So that's the outer layer. The middle layer is the myocardium. Myo means muscle, and this is the thick muscle meat of the heart. So we all know that our heart beats. The myocardium, that heart muscle, contracts, and it contracts like all our muscles in response to electrical signals. And in the heart, there's a couple of centers where those electrical signals are generated. So in the top right-hand part of the heart is the sinoatrial node. It's abbreviated the SA node, and it's what's commonly referred to as the pacemaker of the heart. This is just a bundle of nervous tissue that sends out a signal, a little electrical impulse, that then gets carried down and throughout the heart and really starts that chain reaction of heart contraction. So if the pacemaker is broken, then you end up with an arrhythmia. Your heart doesn't contract properly. So here's the sinoatrial node. It contracts, and then those signals are sent, or sorry, it doesn't contract. It sends out a signal. The signals go down all of these fibers here and also extend into the left atrium. So when the SA node sends out a signal, the atria both contract, and that signal is sent to the second node here. This is the atrioventricular node, because it's between the atrium and the ventricles, and it sends a second signal down to the ventricles, and so you get a second beat. So when you think of like stereotypically the sound that a heart makes, it's like a bump 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 bump. Actually, the medical term is lub dub lub dub. It's a two-part sound, and that's because it's a two-part contraction. The top of the heart contracts, and then the bottom of the heart contracts right after. So the contraction of the heart has a special name. We say that when it's contracting, that it's in systole. That word is pronounced systole, not systole. And when that little, brief second where it's relaxing between beats is called diastole. And those words might sound a little familiar if you're familiar with blood pressure and how it's reported. It's two numbers, systolic over diastolic. So they're measuring the pressure when your heart is contracting and the pressure when your heart is relaxed. So the blood gets pushed through the vessels. The vessels carry blood throughout the body, and we collectively refer to groups of vessels as the vasculature. So you could talk about your whole body vasculature, or like the vasculature pertaining to particular organs, like the intestinal vasculature, or the, the vasculature of the legs. All blood vessels do have a lumen, an open space or channel where stuff flows through, just like the gut has a lumen, any tubular structure in the body. The inner part of the tube is called the lumen. And the lumen of your blood vessels is lined with a special layer of cells known as the endothelium. And these cells are super smooth because you really want blood and stuff. You want everything to be able to flow really nicely. So you don't want it to be rough and bumpy and blood cells getting stuck and stuff on the walls. The endothelium, it should be nice and smooth. If it becomes inflamed and it gets rough, that's when you start having problems. So we're going to talk about the three main types of blood vessels. We have arteries, veins, and capillaries. So arteries are generally pictured in red, and veins generally pictured in blue. And then the capillaries are these tiny little vessels where sort of arteries and veins connect in the tissues. Notice that arteries have a very thick muscle layer compared to veins, which have a very thin muscle layer. Veins have valves. Arteries do not. Those are just a couple of differences between them, but we're going to talk about them more specifically. So let's talk about arteries. Arteries, their job is to carry blood away from the heart. This is the best mnemonic I can give you. Arteries carry blood away from the heart, always. Always, always. That's their job. Most of the time, arteries are going to be pictured in red because most of the blood that's going away from the heart is oxygenated. All the blood that's going away from the heart to the body, certainly, is oxygenated. The exception is the pulmonary artery. The pulmonary artery leaves the heart and goes to the lungs. It's carrying deoxygenated blood. So the pulmonary veins and pulmonary arteries are sort of the opposite of what the rest of the arteries and veins are in the body. Since arteries carry such rich, important oxygenated blood, we need to keep them safe and buried deep underneath the skin so you don't get a cut and accidentally cut open an artery. There are some arteries that are more shallow, and those are ones that you can actually feel a pulse in through the skin. So there's ones in your wrist, in your neck, in behind your knee, to name a few. So because the heart pumps blood through the arteries, we can feel that pump, the pulse of the heart in the arteries. You can't feel it in your veins. Arteries come in all sizes, so the one leaving the heart, which is the aorta, is the largest, and then it branches off into smaller branches that we call arterioles, very similar to how the bronchi in the lungs branch out into bronchioles. Remember that suffix means small thing. So arterioles are small arteries. Arteries also help to regulate blood pressure. So remember, they're very muscular, and so the muscle in the arteries can constrict, and that causes the blood pressure to go up, because kind of like think of a hose and you like squeeze the hose and the water shoots out harder. It increases the water pressure. But if you dilate the blood vessels, they become wider and the pressure goes down. So high blood pressure can oftentimes be caused by vasoconstriction. A lot of times even like little things like meditating and relaxing can help you really lower your blood pressure because it increases vasodilation, and that helps reduce blood pressure. So this is just a picture of a blood pressure monitor, or a blood pressure cuff is what it's called in, like, I don't know, 99% of facilities. But if you want to be really in the know, the real technical term for this blood pressure cuff equipment is called a sphygmomanometer. I don't know why, I just love saying that word. It makes me feel fancy, like it rolls off your tongue funny. Sphygmomanometer. It's actually the technical name for this device. And basically the way that it works when you measure blood pressure is the cuff squeezes real tight and it cuts off the blood flow, kind of like this girl is cutting off the flow of water through this hose. And then you slowly release it and you listen for the sound of blood to come through and get the reading of the blood pressure. So you take whatever the pressure on the cuff is when you hear the sound of the blood coming back through. Okay, veins. Veins always, they carry blood to the heart. So arteries carry blood away, veins carry blood to the heart. Since most of your blood in your body is that's being carried by veins is deoxygenated, it's blood that's been spent, used by the tissues, and it'll all come back. So veins carry blood to the heart. They're usually blue because of that deoxygenation. And the exception again being the pulmonary veins, which are carrying blood from the lungs to the heart, and then they're going to be bright red, full of oxygenated blood. Veins have valves, which arteries do not, and they help to reduce the backflow of the blood, particularly in things like the legs. So again, the veins are not as muscular as the arteries, and so they don't use as much of that smooth muscle to move the blood through the way that your arteries do, that they constrict and dilate. Instead, you use a lot of your body muscles. You depend on your skeletal muscles to push blood like up your legs. So the valves just help keep the blood moving in one direction, up, basically, up the legs, so they don't pool back down in the legs. But we'll talk about some disorders where blood does start to pool. Veins are sort of large, and they branch into smaller veins, which we call venules. So the suffix "ule" has the same meaning as "ole." I guess venole sounded weird, so they changed it to "u," and venules is the word. Veins are much more superficial, generally, than arteries. A lot of times you can see them through the skin, and they actually appear blue through the skin, which is why we color them blue in textbooks. But just for you know, deoxygenated blood is not blue. It's a dark red, like a Merlot color, versus oxygenated blood, which is a very bright red. It just looks blue through the skin because of physics and how light is absorbed and emitted, and I can't explain it. So the third type of vessel are capillaries. And is this animated? Oh, my animation's not working. So capillaries are really, really tiny vessels. So arteries branch into arterioles, which branch into capillaries, which are so thin that actually only like one blood cell at a time can pass through. Like they have to pass through single file. That's how thin they are. So here's an artery over here, so it's bringing blood to the tissue, and the blood goes here through the capillary, and oxygen can move out of the blood into the cells here, and then these red blood cells are now empty of oxygen, and we have deoxygenated blood going into a vein where it's going to travel back to the heart. So capillaries are where gas exchange occurs, where internal respiration, I should say, occurs, where oxygen moves from the blood into the cells, and carbon dioxide waste products from the cells move into the blood and get carried off. So some really important blood vessels to know: the great blood vessels, the aorta, which is the largest artery, and the vena cava, or the vena cavae, because there's two of them, are the largest veins. And then the second largest ones are the pulmonary arteries and veins, which transport blood to and from the lungs and heart. So the aorta is pictured here. Here's the heart. The ascending aorta goes up, and then we have the aortic arch, and then the descending aorta goes all the way down through the thoracic cavity, the abdominal cavity. Coming off the aortic arch up here, we have blood vessels that are going to feed the top of your body, basically your arms and your head. So the one that goes up to your head is the carotid artery, goes up through your neck. And carotid is interesting. It actually is a combining form that means sleepy. So it was well known, even in ancient Rome and Greece, that if you put pressure on the carotid artery on the neck, that you could make someone pass out, think the sleeper hold in wrestling. And so the carotid artery, it brings blood to the head, including the brain. So if you cut off blood flow, you cut off blood flow to the brain and you pass out. And as long as you relieve that pressure, you wake back up again. The subclavian artery goes under the clavicle. That's literally what the name means. The clavicle is the collarbone, so it goes under the clavicle and actually down the arm. And so that's what those two are. This one here is called the brachiocephalic trunk. That's because it is the right leads to the right subclavian and carotid arteries, which go to the arm, brachio, and head, cephalic. So that's why it's called the brachiocephalic trunk, because it's a trunk that branches into the arteries that go to the arm and to the head. Another important set of arteries here are the coronary arteries. So the coronary arteries are actually the first arteries that branch off the aorta. You can see where the aorta starts right here, and you can see these coronary arteries coming down here. So although the heart is full of blood, it can't actually get oxygen from the blood inside the heart. The muscles of the heart need to be fed by arteries just like the other tissues in the body. And since the heart is so important, it feeds itself first. So the coronary arteries are the first arteries to branch off the aorta. And corano actually means to encircle like a crown. Think Corona beer has a crown for a symbol. Or if you have kids and you've watched Frozen a lot of times like I have, the coronation ceremony, a crowning ceremony. Corano means crown. And if you think of the heart as kind of like the king or queen organ of the body, this is pretty important, then it seems fitting that it would wear a crown. So the aorta, as it goes down through the thorax and the abdomen, all right, it becomes the thoracic aorta, and then down here is the abdominal aorta. And I read somewhere once that it's as thick as a hose. It's a really thick artery. So it's buried really kind of deep in the middle of your abdomen. Keep it nice and safe. And a bunch of arteries and arterioles branch off of it to feed various organs within the abdomen and the thoracic cavity. If we look at some other major arteries, there's the carotid artery that goes up to the head, where if you cut it off during the sleeper hold, you make someone pass out and fall asleep. Here's the subclavian artery, goes underneath the clavicle, the collarbone, and down the arm. And as it moves down the arm, it thins out and its name changes. So here's the axillary artery. Axillo means armpit, so it's the artery in the armpit. The brachial artery here in the upper arm, brachio means upper arm. And then down in the lower arm it branches into the radial artery and the ulnar artery. Those are the bones of the lower arms. They're named after the bones of the lower arms. The abdominal aorta branches here around the hips into the iliac arteries. So these are big arteries that flow past the hips. Iliac with an I means hip bone. You go down the legs, and again we see that these big major arteries are named after the bones that they sort of overlap with. So the femoral artery here, it lies on top of the femur, and the tibial artery here lies on top of the tibia, the shin bone, and then the perineal artery is not actually named after its bone. The bone here is the fibula, but it's called the perineal artery. And then the popliteal artery is in the knee. Some major veins to know: the vena cava, which is singular, vena cavae is plural, are the two big vessels that bring blood into the heart from the body. I'll show you in this slide here. So here's the superior vena cava and the inferior vena cava, and of course they both bring blood to the right atrium of the heart. Other major veins: the jugular vein, which is in the head, is sort of like the opposite highway of the carotid artery. The portal vein, which carries blood from the intestines to the liver, so it's like super rich in nutrients. It's like all the nutrients you just digested and absorbed, getting transferred to the liver, and then the liver decides where they all need to go. So a little overview of the circulation here. So let's start with blood coming from the tissues in the body. So you have used up the oxygen, the blood is deoxygenated, it comes from the tissues. The capillaries carry it through the venules, carry it through the veins, and it comes through the vena cava. So blood from the top half of the body comes through the superior vena cava, and from the bottom half of the body through the inferior vena cava into the right atrium. You get a contraction. The first contraction, the pacemaker, the sinoatrial node, sends that first contraction. Blood goes into the right ventricle, and then the heart has that second contraction, and it pumps the blood to the lungs through the pulmonary artery. It's taking blood away from the heart, so it's an artery. And then it goes to the lungs where it picks up oxygen in the capillaries around the alveoli, and then comes back through the pulmonary vein to the heart, specifically to the left atrium. And then the atrium contracts and it goes into the left ventricle, and then it flows out through the aorta to the body to bring blood to the body through various arteries and arterioles. So we call this, so the circulatory system is really two circles. It's an inner circle, which circulating blood from the heart to the lungs, and this sort of outer circle of circulating blood from the heart to the body. So the heart to the body circulation is the systemic circulation, heart to lungs is the pulmonary circulation. So now for some diseases and conditions of the cardiovascular system. You can have a disease of the heart muscle, of the myocardium. A sort of general overarching umbrella term for that would be a cardiomyopathy, which just means a disease of the heart muscle. So there's lots of different things that would be classified as a cardiomyopathy. Ischemia is a condition of blood being blocked. Isco means blockage. If you have ischemia, a lot of times you feel pain in the chest. And chest pain as a symptom is called angina pectoris, oftentimes just abbreviated to angina, and that means chest pain. Chest pain can be a sign of myocardial infarction, which is the medical term for a heart attack. So in the healthcare field, you will rarely hear people referring to things as a heart attack. They will say an MI. Somebody's having an acute MI, which stands for myocardial infarction. And it's just a blockage of blood flow to the heart muscle. And it can be very dangerous, depending on how much the blood flow is blocked. If it's blocked significantly, it can actually lead to death or necrosis of heart cells. Congestive heart failure is a more chronic condition, and it is due to the heart basically working too hard because of other underlying conditions like COPD can lead to congestive heart failure. People with sleep apnea can develop congestive heart failure if they don't know that they have it and it goes untreated. And it's over time, the heart basically has trouble pumping blood and has to pump really hard. And over time, the heart muscle actually grows and gets bigger, but as it does so, it gets more tired as well. And so essentially, it's like an exhausted heart. The heart is one muscle in the body where if it's bigger, it's actually weaker. Whereas other muscles, your skeletal muscles, when they get bigger, they're stronger. Some conditions of the heart valves. You can have endocarditis, so you have valves inside the heart, and endocarditis is inflammation or infection inside the heart. And since the heart lining, the endocardium is actually pretty smooth, the most textured surface for like bacteria to bind to are usually the valves. So if you get an infection inside the heart, it's usually because there's bacteria growing on the heart valves. Mitral valve prolapse is a disease where the mitral valve doesn't close properly, and so you get regurgitation back through that valve, so it doesn't perfectly keep things going in one direction, and you can hear it with a stethoscope. It sounds like a little gurgling sound, and some people are born with it. It could be a congenital condition, or it could be a result of an infection, and it may or may not present problems to the person depending on how serious it is. Pericarditis would be inflammation or infection around the heart. Now remember, the pericardium has two membrane layers, and then fluid in between them. And so when you have pericarditis, you get an influx of extra fluid in that pericardial space. And that is called cardiac tamponade, or a stopping of the heart. So it basically sounds like the heart is being smothered a little. There's a specific sound that doctors can hear when they listen to the heart. They hear that sort of muffled sound of the heart beating, and that's a sign of pericarditis. And the treatment for it is actually a pericardiocentesis, which is on a future slide, but it's a procedure to puncture that pericardium and withdraw some of that fluid and relieve that pressure on the heart. Stenosis is a narrowing of blood vessels, really. So it could be anywhere. Stenosis can happen in any blood vessels. I guess it's not necessarily a heart problem. But if it happens in the coronary arteries that feed the heart, that's particularly problematic. And that does happen a lot. Some conditions about heart rhythms. So the previous slide was all about stuff pertaining to the heart muscle. Now for the heart rhythms that affect the contraction system or the conduction system of the heart. An arrhythmia means without rhythm, a condition without rhythm. Dysrhythmia means a condition of abnormal rhythm, and they're kind of synonymous terms, but arrhythmia is used far more often. So bradycardia would be a slow heart rate. Tachy is fast, so tachycardia would be a fast heart rate. So you can see here what a normal sinus rhythm looks like. I don't really know much about reading EKGs, but these are contractions, and there's some stuff that goes on in between. So if these contractions are further apart, that means the heart rate is slower. When they're quicker, then that's tachycardia. Fibrillation is like I like to think of it as like almost like a muscle spasm, like a Charlie horse of the heart. So it's not really contracting, it's more like muscle spasming, which is not actually pumping blood properly. And so you go places and they talk about defibrillators, having emergency defibrillators. So somebody's having fibrillation, experiencing fibrillation. A lot of times you can shock them, and that jolts the pacemaker of the heart back into a normal sinus rhythm. But fibrillation is not, the heart is still working, it's doing something, but it's not being effective at pumping blood. And then asystole means without contraction. And if you look at an EKG during asystole, that line is flat. So when you hear the term that somebody's flatlining, all right, it means they're experiencing asystole, no heartbeat. Some conditions of the blood vessels. An aneurysm is a weakening of the wall of the blood vessel. And what can happen is then those weakened walls can rupture and you can have internal bleeding. And depending on which artery we're talking about, that can be minor or it can be very serious. The most serious type of aneurysm is called a triple A. It's an abdominal aortic aneurysm, and it's in the abdominal aorta, that big, thick, hose-like vessel that runs down the abdomen. And it's dangerous because there's no symptoms of an aneurysm. You don't have any symptoms of an aneurysm. What you have symptoms of is when it ruptures. If an aneurysm ruptures and bleeds, if it's in the brain, you can suffer a stroke. If it ruptures in the heart, you can have a heart attack. But if it ruptures in the abdomen, in the abdominal aorta, you're dead. I mean, you bleed out internally very quickly. So that's the danger of aneurysms is if they're in important vessels, they're basically ticking time bombs that could rupture and cause problems. But the aneurysm itself usually doesn't have any symptoms, so it's often found just in scans if doctors, I don't know actually, sometimes I think they're found. I had a friend, a story about an abdominal aortic aneurysm. So a friend of mine got into a car accident one time and he was fine, But the car accident was severe enough they wanted to run some tests and just make sure he didn't have any internal injuries. So they did like a full body MRI or CAT scan or something. And he didn't have any injuries from the accident, but they found accidentally, basically, that he had an abdominal aortic aneurysm. And so they scheduled him for surgery right away and fixed it. Basically, that car accident actually could have saved his life because he could have died any day from that that AAA rupturing, but instead they found it because of that car accident. So sometimes aneurysms are found what it's called an incidental finding, when they're doing a x-ray or a scan or something for something else entirely, but then they happen to notice, oh, by the way, you have an aneurysm. Another very common disease of the blood vessels is atherosclerosis and arteriosclerosis. So the arteries getting full of fat or just becoming so inflamed that they get hard. And so sclero is a hardening of the blood vessels. And you can see here a picture of some atherosclerosis where you get this fatty plaque buildup that can completely occlude or block the blood vessel, and that's really dangerous, especially in blood vessels to the heart, and that's where it often happens, just because of how fat flows through the blood vessels. So coronary artery disease is when you have a buildup of fatty plaques in the coronary arteries. If it's in the legs, it's called peripheral artery disease. One of the signs or risk factors for atherosclerosis is hyperlipidemia, a condition of the blood that has an excessive amount of lipids. The more cholesterol that's flowing through the blood, the more likely it is to deposit on the artery walls and cause these plaques and these buildups. Some other blood vessel conditions. Hypertension is the medical term for high blood pressure. It's often just charted as HTN for short. The opposite of hypertension is hypotension, too low blood pressure, and that will make you very weak and feel dizzy, like you're going to pass out. And there's a condition that's fairly common called orthostatic hypotension. Now, you may have experienced this in your regular life, like I have when I was a kid. I used to experience this all the time. I'd be like laying on the couch watching TV, and I'd get up too quickly. And so orthostatic hypotension, it means that you have a drop in blood pressure when you straighten up from a static position. So basically, if you've ever experienced that sensation of you got up too fast and you got kind of dizzy and felt like you were about to pass out, that was probably orthostatic hypotension. So it's, even very healthy people can experience that if they're very relaxed and they get up too quickly. But sometimes people who have blood pressure issues experience it, they're much more sensitive to it, like just changing position a little bit. Even if they get up slowly, they experience it. So it's something to know about patients if you're taking care of patients, because you definitely want to be very careful when they get up, because if they experience that blood pressure drop, they faint, basically. They pass out, and then they can fall and hurt themselves. So it's not, the blood pressure drop is not dangerous in and of itself because it's usually restored very quickly. But if you fall, you could seriously injure yourself. That's the danger of it. Phlebitis is inflammation of a vein. So like sometimes you might get that after having blood drawn, having a vein punctured. You may get a little infection, a little inflammation. Varicose veins is what's pictured in the picture here. So these are veins where basically the valves have failed. The valves are not working and blood is starting to pool in the veins. So you see varicose veins in the legs, the most common place to see them, because of how important the valves are in blood flow through the legs. So some other types of varicose veins that are not visible are gastric varices, which are basically varicose veins around the stomach, and hemorrhoids, which are in the rectum. They're basically varicose veins of the rectum. They're just small, swollen veins. Some laboratory and diagnostic procedures that can be done for the heart. You can get an electrocardiogram, which is an ECG, or more commonly called an EKG. They both stand for electrocardiogram. Just one, the EKG, I think, uses the German spelling of cardio. So that is for looking at the electrical activity of the heart. So you're looking for arrhythmias, for fibrillation or tachycardia. Right? An echocardiography uses ultrasound, echo means sound, to look at the structures of the heart using those sound waves. So they sound alike, electrocardiography, echocardiography. But they're two different things. One is looking at the electrical system, the other is looking at actually the structure of the heart, and that's a picture here of an ultrasound and an echocardiogram. Auscultation, again, is just using a stethoscope to listen, and you can learn a lot about the heart from just listening to it. And an angiography would be a procedure to take a recording of the blood vessels. So usually that involves injecting some kind of contrast dye into the vessels and then getting an X-ray or a CT scan in order to visualize the blood vessels, because you can't really visualize them without injecting some kind of a dye to make them show up on the film. But you can look for things like blockages. Some medical and surgical procedures, if you have an aneurysm, like my friend who had that AAA, he had an aneurysmectomy where they basically cut out that weak area and then they do an anastomosis. They sew the ends of the blood vessel back together. A cardiopulmonary bypass is so bypass surgeries, what they do is they are doing surgery on the heart and they're bypassing the lungs. So they pump the blood through a machine called a heart-lung machine where it gets oxygenated and sent back into your body. So in order to do surgery on the heart, they have to have a way to get oxygenated blood to your body. So it's like basically this machine that oxygenates blood and pumps it back to your body. So it acts like the heart and the lung. A pericardiocentesis is a procedure to puncture the pericardium to withdraw fluid. So that you would have that if you had cardiac tamponade or pericarditis, inflammation of the pericardium. Some other surgical procedures, an angioplasty literally means a surgery to reshape the vessels. So some examples are down here. You can have a balloon angioplasty. These are done a lot on people who have atherosclerosis. So doing surgery and cutting out that area of plaque buildup is pretty invasive and can be dangerous for people who have this. So angioplasty procedures can often be done fairly non-invasively. They just stick like a wire or a tube in the blood vessel, so it's not, they don't cut you open, just a very small puncture. This is usually the first step. So an balloon angioplasty goes in with like a deflated balloon and then inflates it, and that pushes back those plaques and widens the lumen of the blood vessel. Another one is that they can have a stent put in. So the stent is like a collapsed cage, goes into the blood vessel, and then it pops open, and it helps to hold the lumen open and push back that those fatty plaques. Now, both of these procedures are usually not long, like they usually buy someone 5 years or so until they actually need to have surgery, like bypass surgery, for example. So it also gives them a little bit of time to change their lifestyle and dietary habits and potentially improve their blood vessel health and not have to have surgery. Valve replacements, if the valves are damaged in the heart, they can be replaced, usually with prosthetics, like artificial tissue, but sometimes it's with tissue from other animals like cow or pig hearts. A valvoplasty would be a procedure to surgically reconstruct the valve. So doesn't need to be replaced, it just needs to be like sewn up and reconstructed. And then lastly, the drug categories for the cardiovascular system that I'm going to focus on. Antiarrhythmic drugs are drugs that are given to people who have arrhythmias, like fibrillation or tachycardia. An anticoagulant drug and thrombolytic drugs are similar but different. They both have to do with clotting. So the blood clots, we say it coagulates, and clots, of course, can end up clogging arteries and causing like pulmonary embolism or a stroke or a heart attack, a myocardial infarction, I should say. So an anticoagulant prevents the blood from clotting. A thrombolytic, thrombo means clot, blood clot. So thrombolytics break up blood clots. Anticoagulants prevent blood clots. Sometimes people will be on both. Sometimes they'll just be on one. Certainly if they're on both, you want to be careful about the dosage because it really thins out your blood essentially, and you don't want no clotting. You want to have the right amount of clotting. So an antihypertensive drug is one to treat high blood pressure, to bring down high blood pressure. And statins, the statin is not a word that's a medical term that you could break down and do word surgery on like these other ones, but they're so commonly prescribed, therefore, people with hyperlipidemia. The end.